everybody. I'm Megan Fraser McGrogan, the Executive Director of the Greater Utica Chamber of Commerce. Thank you so much for joining us today. We are now embarking on our 31st episode of the Leveling Up Social Distancing series. And we started this back when the pandemic started hitting our area to basically make sure that you are in touch with all of our businesses and organizations, and we want to make sure that you know what they're up to, how you can access them, and in this case today, what they're doing to make sure that our community stays healthy throughout all of this. So I'd like to welcome my guest today. Welcome from Mohawk Valley Health Systems, Linda McCormack-Miller. Linda, welcome.
Thank you very much.
Now, tell everybody what you do at MVHS, Linda.
Yes, so my role is I am the Chief Nursing Officer. So I'm responsible for policies, procedures, processes for nursing and nursing services across MVHS.
Mm-hmm. And that must be a super important position during this time because, you know, obviously you have a lot of nurses managing this pandemic and a ton of frontline workers at MVHS. So what's that experience been like for you?
The experience has been very challenging at times, very exciting, but also, I think, transformational for this system. Mm-hmm. You know, we've been sharing our story for many weeks now. This began way back in January when we became aware of the risks that were happening within the United States, and then in New York City, and then as it became apparent that it was going to impact all upstate New York. Mm-hmm. And we had a call with the governor, who basically gave a directive to all hospitals in New York State to be able to at least double your capacity and prepare for what was going to be a significant influx of patients. Mm-hmm. For our nursing staff, the world changed very quickly with the cancellation of elective surgeries and all elective procedures, and then with preparing nursing units that had been closed to be able to add additional beds and prepare both campuses for that influx. Mm-hmm. In addition, for our nursing staff, we redeployed nurses who were working in ambulatory surgery or in the OR or in some of the specialty practices were then redeployed to the nursing units to be trained on the electronic health record and how to prepare and take care of med-surg patients. Sure. And a lot of education, a lot of training, a lot of preparation. Mm-hmm. And for our nursing staff, and I would say for everyone, this has been significant within the community. Number one, MVHS is here to provide care to the community. Mm-hmm. So everyone really rallied around that, and it was all about what can we do to prepare for this influx of patients. But I also think it's important to know our staff were dealing with challenges at home with, like everyone else, kids were home from school and they're trying to arrange daycare. Sure. They were dealing with a work environment that was changing rapidly. I might have been working in an outpatient setting and now I'm on an inpatient unit. And they were also fearful of a lot to learn about COVID, how to care for these patients and how to protect themselves. Sure. And just amazing how well the staff came together and how well the community came together to make sure if we were to get that influx of patients that was predicted, we would be ready to serve this community.
Mm-hmm. And I think it's really cool for a lot of people watching this. I mean, a lot of us tune into the governor's daily addresses and the county executive's daily addresses. And, you know, we've all been hearing about this preparing that's happening. And so it's really cool to talk to somebody on the side that has been doing the preparing. And if you don't mind, I'd like to talk about that just for a second, because, you know, our area does have a significant, you know, compared to a lot of areas, we do still have a significant amount of patients. Do you guys feel like, you know, we didn't get any, I don't know if you can comment on it or not. Did we get any people come up here from downstate? Like, did your capacity increase?
Not patients that were sent. Initially, they were going to transport patients up from the city to upstate New York to be cared for in the acute care hospitals. We did not experience that. They added additional capacity, as you know, with the Hospital Ship Mercy and some of the field hospitals to support those patients in the area. But we have served a fair number of COVID patients, both in the ER and on the inpatient setting. And thankfully, really have discharged, 85, 90% of the patients that we served. So we're thrilled that we were able to provide the care that we were able to provide, the excellent critical care specialists we have in both of our ICUs were just phenomenal, and manage that patient population appropriately and safely on our med-surg units.
I know I did. I watched on social media every time you guys discharge, you do a little celebration. I think that's so cool. People can go to MVHS's social media to check out all of that. I think that's so exciting and celebratory. We've all had to experience this in all different ways. And I just think it's so positive that you guys are doing that and sharing that there is a light at the end of the tunnel should you become hospitalized.
Yeah, I think it really has brought us together. We meet just about every morning, incident command, for an hour and a half as we prepare for now ramping up services. So we didn't get the surge. We now are in the process of beginning elective surgeries, beginning doing procedures, seeing our volumes increase. And our commitment has really been to reassure the community that we have safe paths and safe practices across MVHS systems, and that we're ready to care for anyone, our community, should they need our services. And we've changed things. We've advanced our technology. We're fully implementing telehealth in all of our practices. We are beginning to really promote the use of MyChart for those individuals who are seen in our practices. And you're going to see even more technology pushed out as we look at different ways to meet the needs of the community that we're here to serve.
And I think that is so important. And in a lot of these interviews that I've done, we've all talked about how we've had to pivot, right? And you have to make changes in your business. And, the hospital system certainly has really taken the brunt of those changes, right? But it's so cool to see that things are going to come out of this and maybe present opportunities that wouldn't have been there prior to the pandemic. And so if there's, I'm sure for you guys, it's a little tough to find the silver linings. I can't imagine what you guys have gone through, and I know we visited last week, well, actually the past couple weeks, to make donations for our Feed Our Frontline Families campaign. So I personally went from very, very far to take some pictures on Monday, and just to see how you guys have adapted and made sure that you're keeping everybody healthy, and not a bad thing that you prepared for a surge that didn't quite happen because you've learned how to adapt, right?
One of the areas that has been stressful for our nursing staff, our physicians, and our patients especially is having no visitors. So right now, the governor has approved a couple of pilot sites in New York State to begin to look at how we can have visitors again and do it in a way that's very safe. And we here greatly appreciate the community's support and understanding during that. I think that was very hard, but everyone has been wonderful, and we do appreciate that. And we look forward to beginning to have patient visitors sometime soon in a way that is very safe.
Well, and that's an interesting point too, because if you think about the nurses, not only are they, maybe adapting to some new policies and procedures, but they're really having to be the hand holders, I would think. I mean, they do that all the time, but even more so when you're not allowed to have visitors in. And so, the compassion involved in all of that is just really admirable.
Yeah, I mean, just amazed and very thankful to work in an environment where we have such dedicated staff, and they really rose to the occasion. And I think our commitment is to the patients and the community that we serve. And also just in awe of the firemen, the policemen, all the teams of individuals that support this community that have helped us in various special ways over the last couple of weeks, and we're very thankful and feel very blessed.
Sure. Yeah, and it is important to support all of the people that are frontline workers, first responders, healthcare workers, because like you alluded to earlier in the call, we're all stressed out even being at home, and all of these individuals have families and people to care for too, and it's a whole another set of stresses coming home and making sure that you're, not bringing the virus in and hosing yourself down outside. Right. Yeah. So it really is just remarkable how everybody's pulled together to support, frontline workers. And we really do appreciate all you're doing, to support the community. And I should mention, in addition to supporting the community, or part of the way you support the community is by being a platinum investor with our Chamber of Commerce. And, we really appreciate that, because that has allowed us to be doing things like this during this time when, the income model is a little bit different. A lot of these businesses are struggling. And so the investments that MVHS and our investors make in the Chamber have allowed us to provide some of these programs during this time when we otherwise wouldn't be able to. So
thank you.
We have to give you a shout out for that. Is there anything else that you want to talk about this morning?
Just that we're here to serve the community. We are beginning to do elective procedures. We want to make sure people remain safe. We want to make sure people have their mammograms, and their health checks. We want people to remain healthy, but we want people to feel comfortable coming back to MVHS for their services, and because that's what defines us here.
Yeah,
and
actually,
always open to feedback and how we can do things better.
That's great. You mentioned something that I wanted to touch on really, really quickly. So you mentioned routine things, right? And I think that that's another concern that has come out of this, is people might be kind of shying away of their routine care and routine appointments. It sounds like those things are full steam ahead, and not only do you have telemedicine, but you have proper precautions set up so people should feel safe.
And all of our outpatient practices in our diagnostic area, in our lab areas, across the system, we've been putting safe practices to ensure patient safety. And I do want to mention that we have seen a drop in our ER visits, but what we're seeing is when people are coming in, they're coming in after having been home and sick for a while. And sometimes the earlier you get seen and evaluated, the better the outcome. So if you're in chest pain, please don't wait 24 hours to come in and see us. We want people to remain healthy, but we also want people to get the care they need to remain healthy. So
that's really important to remember. Okay, good. Well, if people want to learn more about the hospital system and everything that you guys are doing, just give us the website and any other way they can get in touch.
Yeah, mvhealthsystem.org.
Yeah.
You're going to pick that up for everyone.
Yep, we'll put that up. Yep, so mvhealthsystem.org. And again, you guys have very active Facebook, Instagram.
Yes.
This video will also be featured in a spotlight that we're doing on you guys. So this is one of our Platinum Investor Spotlight Weeks. So this is why you're hearing from VHS today. You'll also get to see a little bit more about them in our social media. And also, if you're on our mailing list, you'll see that as well. So Linda, thank you so much for being with me. This was so great to hear from you. And I think our members in the community will appreciate the connection with you.
Thank you. Thank you. Have a great Memorial Day weekend.
You too, and stay safe.